right, welcome. I'm Bill Crouch. I'm Secretary, DHHR. I apologize for being late. We were actually in another meeting regarding the coronavirus with the governor. Had a meeting yesterday with the governor. We're very focused on this issue. This is something, as everyone knows from news reports, is spreading in the United States. At this point, West Virginia still has no cases of coronavirus. We have a group here who will answer questions and be available. Let me have them introduce themselves first.
I'm Dr. Cathy Slemp, and I'm the State Health Officer and Commissioner of the Bureau of Public Health.
Jeff Sandy, Cabinet Secretary for the Department of Military Affairs and Public Safety.
Clayton Burch, I'm Superintendent, West Virginia Schools.
Let me talk just a minute about where we are. As most of you know from other news reports, we have decisions being made in the state regarding this virus. Again, we have no active cases in West Virginia. We have tested 8 residents at this point of the state. We have 7 negative results back and 1 pending at CDC. We are capable of doing our own testing right now. That's done under the state lab, under Dr. Cathy Slemp's supervision. So we're pleased to say we can perform those tests ourselves. At this point, we are comfortable moving forward, working with various entities in the community, local health departments. We just had a meeting with the long-term care folks. We're trying to make sure we cover our bases and that we move forward methodically and carefully. We're happy to answer questions if you have. We have no prepared presentations at this point. But we're happy to talk about that. Let me first ask our guests if they have comments.
I'll speak just a second to say that the thing that I think is most important that all of us are doing is that planning forward. And so that's what we've been putting a lot of our energies into, is working with both getting information out to individuals and families, and then also to a variety of sectors to really be thinking about planning forward and preparing. We currently, as we said, don't have any identified cases here, but we will not be surprised when we first find a first one. We would anticipate that in time we will have some community transmission. And so what our opportunity now is to really, all of us, is make an all-of-community approach to planning and preparing and just being wise with that. There are several things that I think are helpful for people to know and understand in preventing disease, and we can talk about some of the specifics of that later, but the basics of this virus are that it spreads like other respiratory viruses, and so it's when we cough and sneeze, we project about those little droplets about 6 feet ahead. So all of our ideas around preventing spread is how do you keep people further apart than that 6 feet or so. It's just the most basic simple concept. So that's when we talk about social distancing, because the way it spreads is you project those respiratory viruses, droplets, about 6 feet ahead of you. But it doesn't just have to land on you. It has to get into your eyes, nose, or mouth, typically. And so that's the whole focus on covering your cough and sneeze and on washing your hands, because the other way that it can happen if it doesn't go into your eyes, nose, and mouth directly from the cough and sneeze is if it's on a surface. It doesn't last forever on that surface, but for a short time period it can last. And if you pick up something on a surface and then put that into your hand into your mouth, then you can spread virus. So it's nothing magic about spreading infectious diseases. It's just like flu spreads or cold spread. That's just the kind of principle behind which we help people understand how this happens. It's not just floating in the air 45 feet away. And this is just like we see other viruses spread. And so the planning ahead now really is about how do we put in place a host of measures, scaling it to where we are in the event to reduce spread of disease. And when a new infection comes into a community, you can have a couple different curves. And if lots of folks are susceptible to it, you can see it, and then suddenly you put no measures in place, then you tend to see disease rise very rapidly. It goes very high, and it's very difficult to handle because it's a little overwhelming. if you can put measures in place that dampen that curve and spread it out longer term and lower, then it's much more manageable as a community. So that's all of those planning concepts and ideas are really around trying to, rather than see a disease curve that goes sharply up and is overwhelming, to as much as you possibly can to dampen that curve and make it lower and over a longer time period, because then you have, it's much more manageable, much easier. So this whole spectrum of things we talk about in terms of disease prevention spread, whether that be as simple as cover your cough, wash your hands, stay home if you're sick, or whether we move into more extensive community mitigation measures, those are all along a spectrum to try to dampen that curve.
WVU has canceled their classes and they're switching to online. One of the concerns they expressed was that with that many students up there, if they had an outbreak, it could easily overwhelm the medical system. Are they overreacting when we don't even have a case, or are they doing things that other people should be doing, which we cancel other things?
Yeah, they thought through that carefully, and I think they had several desires behind doing that, and they realized they could be able to do that. And so it was another way they could kind of do that social distancing with their students. And again, by them taking proactive actions with that, with them taking proactive actions with that, they are similarly trying to kind of decrease that spread so that, again, healthcare systems would not be as overwhelmed with that is one of the rationales. But they also, universities have a lot of international travel and other things that are going on. And so it's a different population, the universities. It's very different there than, say, the school system. Our K through 12 schools, this would not apply the same way at all. So that was a WVU decision, like many other schools around the country are doing, because they are able to transition to more online learning, and they are able to do that work in a different way.
Let me stop for 1 second. I want to introduce Sarah Tucker, who is on the screen somewhere, I'm told.
Oh, good. Yes.
There we go. Sorry, she is online.
Thank you.
Wanted to make sure everyone knew she was here. I apologize, Chancellor, for not doing that.
Sarah, do you want to speak to that question?
Sure, so I'd be happy to. As Dr. Slemp mentioned, the universities have a significant portion of out-of-state students and a number of international students. At this exact moment, our institutions are either on spring break or about to go on spring break, which means that those students are going to be traveling either internationally or to their homes. They are leaving the state of West Virginia, and then they'll be returning to the state of West Virginia after that week, potentially having been exposed to COVID-19 in their travels. And so what the institutions are trying to do is, in an absolute abundance of caution, make sure that their students aren't coming back and posing a risk to the rest of the population of the state of West Virginia.
A lot of this is providing information. So before this is over, we will give you the hotline that we've implemented and the website again, which we give in every press conference to make sure folks have that available. There's a lot of information on that website that can be accessed immediately. So, Secretary Sandy, do you have comments here?
Yes, sir. In December 2016, the governor's marching orders was to make sure that the state of West Virginia was prepared for both natural and man-made disasters. And infectious diseases, the coronavirus may be new, but infectious diseases is not. And since 2005, the West Virginia State Police have had policies and procedures on infectious diseases. And basically, we are adopting those, and we have provided those to our partners. We have Rodney Miller here today, who's the Executive Director of the Sheriff's Association. We have been in communication with the Chiefs of Police Association and with our first responders, the Emergency Managers Association. So we've been receiving information and working with them in detail. For example, we have units such as the Fusion Center and the Watts Center and the State Emergency Operations Center. And they receive information from FEMA, from the CDC, from DHHR, through many other entities. And we receive that information, and our job is to disseminate that throughout the state. And for example, the Sheriff's Association has been instrumental in getting some quality information out there. Now, to move, we have to talk about this building. Our Capitol Police are in the same situation. They have to be prepared to make sure that all of our state buildings are safe. And then we'll move to corrections. Effective today, our Commissioner of Corrections has stopped all visitation coming to our correction facilities throughout the state. Attorneys representing the defendants in these facilities may still continue to come, but we are going to recommend to them to use video conferencing on that. So we're being proactive, and we would be available for any questions later, Mr. Secretary.
Do you have enough kits to test the people here? Is that why we haven't had a case yet? We haven't tested enough, or you have enough?
Yeah, we do have test kits. We have the ability to test at the moment. The package that we received from CDC covers actually around 300 to 400 tests. However, they're changing some of the ways they do that testing, and we can actually double that most likely. We are been told that we'll be getting additional ones. They have not come yet. But I think what's also important to think about, and this is because I don't think any of us, we'd love to have unlimited supplies, there's no doubt. And public health testing wise, we are focusing on individuals who either have a potential exposure that we know of, or who are very specifically very ill, consistent with this disease, and then they don't need an exposure piece with that testing, because that happens through the healthcare workers, through healthcare professionals. But the other piece I think that's going to be very helpful is commercial testing is coming online. And so both LabCorp and Quest have now got approved tests, and so they are beginning to offer that testing. And so I think we will see that's beginning to be available more across West Virginia as well. So I think the system is catching itself up to have broader testing availability. Right now we are using those supplies that we have to make sure that we can be as quick and as effective with targeting the highest yield for use there.
What's the threshold for testing now?
Currently, it's individuals who have symptoms such as fever, cough, shortness of breath, and have some reason to have a good, credible reason they may have been exposed. So they've traveled from one of the level 3 countries around the world, or they've been residing and living in a community where there is sustained, widespread community transmission. That could be domestic or foreign. So or folks that have worked, for instance, on some of the federal response at quarantine stations. So it's twofold. One is you've got symptoms that are consistent with COVID-19 and some credible reason for exposure, or the other category is individuals that are seriously ill, such as hospitalized or may soon be hospitalized. So they have serious illness consistent with this disease. And they do not need to have an exposure history with that situation. And in that situation also, we do ask that providers rule out other causes. They've done a flu test, for example. They've done other respiratory disease panels to see if we've got something else that's causing it, then we can pretty much be assured that it's not COVID-19. So we are testing those two groups, ones with exposure, and then more serious disease, we don't have to have that exposure history.
Let's give,
I'm sorry, what?
Can people ask to be tested?
They should do it through their healthcare provider, and the healthcare providers have the screening criteria, and then the healthcare provider can facilitate that testing being done.
let's hear from Superintendent Burch. We have not heard from him yet.
Absolutely. So first and foremost, we appreciate Governor Justice and Secretary Crouch, Dr. Slemp. One of the things that we've been very clear from the beginning for the last several weeks is clear and concise information and communication to the 55 districts, including the West Virginia School for Deaf and Blind. One of the things that Dr. Slemp and I have talked about on a few occasions most recently is the communication must be concise and it must filter down to the necessary folks that need it. 267,000 children and their families, of course, it is very important that they feel safe and secure in their schools. At this time, we're working not only with our task force, but the U.S. Department of Education. We actually have been doing phone calls with them. We do ongoing communication with the 55 districts. The term that Dr. Slemp used earlier was planning and preparing. Just like Secretary Sandy mentioned with his folks, every district must have an emergency preparedness plan. And we're asking them to get them out, make sure they're up to date. But they're also, don't be surprised if you're going to see some communication coming out from the schools of them talking about these deep cleans. This is not unusual during any flu season we go through. We actually ask them to take those precautions even during flu season, that they take time out when necessary, when there's large exposures, to do deep cleans to their facilities. So again, do not be surprised if we see that. But other than that, we are monitoring it daily. And Dr. Slemp, I cannot thank you enough for making sure the communication is very clear. The 55 county superintendents will actually be in Charleston on Friday, and they will again receive another update. We've invited Secretary Crouch and Dr. Slemp there to speak to them and also take questions and do a Q&A with them on things like travel and spring breaks coming up. So we really, really appreciate the assistance.
Yeah. Good to work together.
I was going to ask, I was going to ask really quickly, just that, you're shutting down, or not shutting down, but making it not face-to-face person with the universities. I understand that there's a difference between universities and elementary, middle, and high school, but what is going to be the trigger? Like, what is going to make you say we need to shut these schools down? What is the concern? When is that concern going to happen?
I'm going to speak to that.
Absolutely.
Anytime you implement any of these community mitigation strategies, you are weighing risks and benefits. And so what we know with this virus is that children, for the most part, are actually, what we're seeing from China, very rarely having disease. It's not like H1N1 when we saw children were most effective. And we're not seeing a lot of infections in children, so we don't know, and we'll learn more, but we don't necessarily know that they are spreading lots to others, because that's what happens in children sometimes as well. So we know that children are lower risk, and so it's not like thinking about nursing homes or other high-risk groups in terms of seniors. So there are lower risks, so that's a helpful thing. When you close a school, as you all know, there are many, many ramifications of that. You have got child care issues. You have got feeding issues. You have parents having to stay at home and take care of children, and so then you get economic impacts of that. So that is a measure that is pretty serious to do because there's so many ramifications of it, as well as the actual learning and all of those things. And so we don't take that one lightly. And so we have there are no plans right now for school closures. We would be doing that more in a situation of, say, we had an actual case within a school within which there was an exposure widely in that school for some reason. We might work with that specific school to close that school for a time period. And then we would. So that's the area that we most commonly would see a school kind of close. There are times when you get more widespread disease in the community, you think about it more broadly, but that's the.
Dr. Chancellor, would you like to, Chancellor Tucker, would you like to weigh in on that?
I would, thank you. So you're going to see differences across our higher education institutions in the way that they make decisions about going to fully online courses, keeping dormitories open, shutting down dormitories for short periods of time. And that's because every single campus has different needs with different student populations. Mm-hmm. So we're seeing all of our campuses taking very proactive measures at each institution level. They're paying particular focus, as I mentioned before, to spring break and mitigating any potential threats related to students to the state after traveling. But their preeminent goal and the state's preeminent goal is to maintain the health and safety of all of those within and around our campus communities. And we're going to keep coordinating closely with Secretary Crouch and Dr. Slemp and all of our institutions to make sure that our colleges are safe. I echo the comments made earlier that at this point there is no long-term plan to close an institution for a semester. We are simply taking some proactive steps to make sure that our campus communities are as safe as possible for our students and our faculty and staff.
I think Chancellor Tucker brings up a good point, and I think you will see that community, this is where we give information to communities and then they plan accordingly, because things do vary community to community. And over time, if we see this disease coming through West Virginia, there will be communities at different levels of impact. And so you will see communities adjust to what works best for them and how we work with that.
Have there been any efforts to assist healthcare providers, particularly hospitals, I'm thinking of in two ways. This would be immediate question for Secretary Crouch and Dr. Slemp. Number one, I'm wondering if you've sent them any sort of like a protocol or something that they should go by regarding maybe screening and isolation. Number two, I'm wondering if there have been any additional resources set aside or sent to those providers that they might need for things like masks or gloves or ventilators or extra staffing, all kinds of
Right. So just as Secretary Sandy mentioned, there's been lots of planning and preparedness planning. That's been happening in the healthcare system for several years as well. We actually have hospitals and other partners are organized in some regional planning groups and coalitions. So hospitals have been they have to do emergency plans. They each have to have an emergency plan, and they've been doing and work along those lines for years. They're now working to adapt those to this specific event. And so there's lots of guidance that's been made available to facilities around that. So there is there's CDC guidance that we've been encouraging and passing on around for hospitals, for long-term care, for other entities. So we provide that guidance. We've also sent out health alerts to our providers around the state, which has information on the current status and testing, how do you arrange for testing, how do you report this disease, et cetera. So there's actually, if you go to the cdc.gov site and under healthcare, you will find lots of guidance available about infection control and about how you handle a case and all those kinds of things. We also ask hospitals to plan for things like surge capacity. If you had large numbers of people in your facility, how would you do that? So they've been planning that for a long time, and just like everybody else doing the preparedness and planning piece, looking at those plans and applying them specifically to this particular event.
Let me respond to the issue of masks and gowns and personal protective items. The governor and I have been on 2 calls with the Vice President and Secretary Azar. They have relaxed their purchasing requirements and are trying to move quickly to provide more of those products. 2 states get more of those products actually manufactured. Some of the N95 masks are not really, there's not really a high demand for those in the past, so they're increasing the supply of those. I was just on a call with, actually with Dr. Slemp from the White House. They had over 5,000 people on it to give updates regarding this virus. So it is an all hands on deck issue, and from Washington down, and again, the governor is very engaged. I was with the governor for about 3 hours yesterday. Much of the conversation was about this issue, and he has a very good grasp of where we are with this issue and the decisions even going forward that need to be made. So we've had a lot of discussion, again, from the top down. We've had communication, a lot of communication with our local health departments, with folks in the community, and as Dr. Slemp said, each community is going to have to react differently depending upon the situation in that community. So we're available for calls. Sometimes that's difficult to do immediately, but we want to be responsive. We want to keep our citizens safe, and we want to make sure that we do everything we can in that regard.
Secretary Sandy, adjacent states have recommended canceling church services. I think they still have less than a dozen victims. Are we at that level where we would suggest people don't go to public gatherings or cancel public gatherings?
We would not make that recommendation. Again, and I've said this before, we still, individuals in the state are still relatively low risk. We do not have a lot of international travel, so that reduces our risk. We will, I am certain, get a case of coronavirus. I believe that will happen, but if it doesn't, we'll be thankful. But we probably will get cases in West Virginia, but what we're trying to do is be prepared to react to that and do the proper things to make sure it doesn't spread. And again, back to the hand washing frequently, back to the covering your mouth, using your elbow, not shaking hands. I told someone earlier, I swore yesterday, I promised I would not shake hands all day. My first meeting was with the governor, and he shook my hand, and then he used sanitizer on his hand, and he even sanitized his phone while we were talking. That's a good habit to get into. Folks need to use those kind of things, those kind of products, to just as a habit to keep viruses and disease from spreading.
So a question for Secretary Sandy.
Let's have the fellow in the front here. Yes.
Question for Secretary Sandy. What is the role of the Division of Homeland Security Emergency Management during all this, and what is that agency doing to prepare for what could happen should we get coronavirus in the state?
We have a group put together of individuals, which we call the Homeland Security Advisors. For example, Lieutenant Colonel Nelson is here today. He is one of those. And we have been meeting. We've had an extensive meeting with DHHR, and we appreciate that very good meeting. But we need to prepare for the unexpected. And having said that, to give you an example, a West Virginia trooper or a Boone County deputy arrest an individual that has fever, shortness of breath, and the other elements. They're arrested and they're in a confined area, a cruiser. And the things we're educating our law enforcement on precautions to take. For example, the state police already has, if you have an individual that is spitting at you, they have masks for that. So we're educating and working with our city, county, and state law enforcement. The corrections, we have in each unit, we have a medical unit, and we will have to quarantine the individuals if they obtain this virus. But some of the questions that we're working on is what happens if you have an individual who has those elements of the virus before they actually enter into a correctional facility. And we're working with our hospital partners where we will have to provide 24-hour security there while that person is in quarantine. So there's a lot of work involved in this from the public safety side, sir.
What are we doing, what is the protocol? If someone is under investigation, what are they being told to do by their healthcare providers?
Sure. If someone is under investigation or we're evaluating them for this, we actually ask them to stay away from other folks. So we're asking them to stay home, to not be at work, if you can at home, be in your own bedroom and own bathroom, et cetera, just so that you're reducing any spread. So it's just those good social distancing, prevent disease spread. Same things you should be doing if you're otherwise sick.
I'll just add, I shook hands with the governor yesterday. When I left him a little while ago, we bumped fists.
Yeah.
So,
And how are we ensuring that people that need to be tested are getting access and being told to go be tested behind the scenes?
Yeah, I think we try to get that message out best we can. We've got the hotline that folks have asked that questions with that. It's talk to your healthcare provider. I mean, people need to treat respiratory illness right now like they would treat any other respiratory illness, whether it be flu or colds or that kind of things. And if you don't need to go to the doctor, you don't need to go to the doctor. You just take care of yourself, you stay home, you prevent spread to other people. If you need to go to the doctor, then you go to the doctor. If you need to go to the ER, you go to the ER. So it's the same tier that you would normally do. If you have reason to believe that you may have been exposed to this virus, you have a travel history or other kinds of reasons why you think you really have been exposed to this virus, and you have those symptoms, we ask that you call your doctor first. just let them know so that they can make sure that they don't have you sitting in the waiting room with them. But we actually, in the waiting rooms of doctors' offices, we also suggest that people let the doctor, the front desk know if they've got respiratory symptoms anyway. We do that in flu season all the time. So you're just trying to minimize spread in healthcare systems. But so right now, you seek care based on your level of clinical need.
Why was it determined that halting visitations at correctional facilities, that doing so outweighed the risk of not risk? Or if you were talking about what the risk-benefit analysis, can you walk me through that for inmates?
Our fusion center in our correctional team has been in constant contact with correctional facilities across the United States, including the state of Washington. And based on the information that we have today, that is our best option to be proactive and to avoid a visitation where someone comes in. For example, they may come in from a large metropolitan area, which is a hot zone for the virus, and they may come to visit an individual in one of our correctional facilities. We want to avoid that. And which goes back to a program we started 2 years ago, and that is the video boards that we're testing at some of our facilities. They're able to check those out, and they're able to actually have video conferencing with their family, which historically has reduced violence and depression in our facilities. So there's a lot of modern techniques that the commissioner is utilizing to address this issue.
The other thing with that is when you've got lots of people living together in close proximity, it's more readily spread. Disease is more readily spread. And so correction facilities are an area that you've got lots of folks living together, close proximity, and you try to do everything you can proactively to prevent introduction to the extent that you can do so.
We don't have a lot of huge events here in the state of West Virginia. Basketball tournament like we want for WVU games won't be till like next fall. But we've got an election in May, and if you kind of look at the time frame it's gone in China and other places, we could be having some problems when people go to vote, and they'll be in the six figures at least. Are there any concerns about that?
Secretary.
Is it the same machines?
Secretary of State's office here, by chance? No. They've been thinking about that and talking to their partners across the country, just to think about what are the proactive things that they can do to minimize that risk or to respond, depending on where we are. None of us have crystal balls. We would love to know what's going to be happening next week and next month and next 6 months. So I think folks are looking at those contingency plans and what would be possible. So they are thinking about that.
Clearly, circumstances can change and probably will change, and as they do, we'll have further updates in terms of what we do and what we recommend to folks.
I want to briefly touch on this. Are we testing enough? I think there's a lot of people that don't think we are, and these numbers are underreported.
I think as a nation, we wish we were testing more. I don't think any of us feel like we are where we'd love to be. I think it's been a national challenge and a real issue. I think we are coping with it best we can, and I think it will get better in time, and a lot of folks are really working on it. We'd all love to have more testing capacity.
Now, we don't, like you mentioned, we don't have much international travel, getting bigger, but, with the warmer weather coming up, and we have Cincinnati, I myself am taking a trip out of Cincinnati, so we have Pittsburgh, Lexington, Louisville, all these other big airports, so is the state working with out-of-state airports to kind of prevent this for people that are taking spring vacations?
Well, I think we get lots of travel questions. I think first you follow the Cdc Travel Guidance. And that's pretty clear, especially looking at international travel. So, that's important. And they've got tiers, level 3 countries, level 2 countries with that. So the first thing is to always check that and know what that is. More domestically, things are changing quickly, of course. And we have limited numbers of communities where we're starting to have more widespread transmission. And so I think what's important is you evaluate several things. If you're planning on traveling, how essential is the travel? Do you really need to? What's the benefit to doing this travel? What level of disease is occurring in that community? And what are your interactions going to be? If you're just going and sitting in a hotel room and coming back, you're not going to be at risk necessarily. You know, and then what's your health status? Are you someone who is at high risk of disease or not? And you know, if you are older or lots of or chronic diseases, that then you'd have a higher risk of complications from the disease if you did that. So I do think it's wise to evaluate travel and the risk and benefits of travel as individuals and families with that. And then I think organizations and companies and universities have to look at their policies around that in terms of you know, are they limiting not just essential travel, and what does that mean? I think everybody's looking at it more closely.
A lot of our rural health departments can be kind of bare bones operations compared to how Huntington and North Charleston. What are we doing to ensure that there aren't barriers to access for people who may not be going to the doctor or have the ability to drive or go or call someone?
Right. Well, our health departments are not clinical care centers, typically, other than we do all the family planning and you know, immunizations, et cetera, but they are not primary care centers. So we need to make sure our health departments are able to do the public health piece of working with their partners in this preparedness, in following up on individual cases and doing contact investigations and management, and doing those kind of very public communication pieces. So we need our health departments to be able to be doing that public health work, and our healthcare system doing the clinical work, and we work and coordinate that together. You know, we have health departments across the state that we are working with very closely. We have calls regularly between emergency managers and local health departments and the state health department and other partners that we're adding into that, providing them guidance for the follow-up when we have persons under investigation, et cetera. But this is why you want a strong public health system every day, because you can't ramp up these systems overnight. You know, so folks are working really hard. They've been doing lots of preparedness before. They're continuing to work now, and it is a busy time in health departments right now, as you can imagine. And we just need to work with them and support them in every way we can, all of us as communities.
I guess you have to pay for all this. Apparently, I just got a press release from the CDC saying we're getting $5 million. Will that be enough, or what are we looking at here? Any feel?
It's hard to say what's going to be enough or what we're going to need. Again, we're working through this daily. We're very engaged in all facets of this and all of the moving parts of this. We're certainly happy to get the $5 million. We've been told that was coming quickly, and they did make that happen, which is pretty unusual sometimes for federal government and state government to move that quickly. But we will use that money wisely in terms of our plans going forward. I can't answer the question of whether that's enough, but we'll certainly, if we need more, we know how to ask the federal government for more too. So. And
I know the Secretary has been very supportive in terms of what we can do internally. The governor is very supportive in terms of we will have the resources we need to deal with this. Legislature was interested and we provided some resources. Federal government is doing that, so we keep working with whatever we need to do, how to make it work.
Dr. Slemp and I had a discussion earlier about moving resources within DHHR to try to make sure the Bureau of Public Health has enough resources and can do the job. And they've stood up very quickly here in terms of being the responsible entity that they are for this virus and this disease, and doing a terrific job, I have to say, in terms of what's needed to be done at this point. We are very engaged, and we'll stay engaged, and we'll contact you for another press release if things change and we need to update you. We want to be open and transparent about this and how it works. Again, part of this is making sure, again, that the educational piece is not lost, that what we can do as citizens of this state to help stop the spread of COVID-19 is probably the most important thing we can do. So that website is probably the most important thing anyone can do in terms of trying to do their part with regard to this. So we've set up the hotline. We have that. We have epidemiologists on call 24 hours a day. So we can move quickly. We can answer questions that need answered. We would just ask everybody to be calm. We understand the obstacles here going forward in terms of individuals not being fully aware and being worried. We know how to deal with this, and we want the public to know that they can do a great deal to address this issue themselves just by using your elbow when you cough, and again, not shaking hands. Those are actually huge things if everyone does them.
They really are, that wash your hands, cover your cough, stay home if you're sick. Those are really, really important. You all are such partners in this arena, getting that message out. And then there's also good resources on the CDC website, or you can link to them from ours as well, in terms of getting your household ready for COVID-19 and what to do if you have a case, and how do you take care of yourself at home. You know, so again, remember, 80% of folks that get this disease, from everything we've been seeing around the world, can handle it well, and it's mild to moderate disease. They can do it at home. We worry about those higher risk groups that are at higher with that.
With those higher restrictions, we have one of the highest risk elderly population, we have a big homelessness, people experiencing homelessness, that transmit disease very highly. Are you guys working with groups and
Yes.
specifically, can we get some specifics on what outreach is being done with this group?
Yeah, we're working very closely with the Healthcare Association, which covers our long-term care facilities, and how and there's guidance out around how to handle that, and we're very closely in touch with them. We're also working and communicating with our senior agencies, have calls with them as well, our senior service agencies, and because this is a critical part of West Virginia, and we do have an older population, higher chronic disease, so that's important. And that's what all of us can do.
I'm sorry?
And that's what all of us can do in terms of, you know, when you're doing your own planning in your family, thinking about who's at risk in your family and how do you best protect them.
Can I just quickly ask?
Yes.
I'm
No,
sorry.
no, go right ahead.
Ralston, I know that there was a service member there that may have come into contact with the virus. I was just curious, I know that person was quarantined. Did they come into contact with any other service members, and were they quarantined? Do we know about that?
Yeah, what you were hearing there is the same thing that we're doing with anybody that has a potential exposure that came back to the state, travelers that returned. There wasn't anything unique about that. When you have someone who was in a high-risk area, may have been directly exposed, then we have been having them stay at home for 14 days after their last exposure, monitoring temperature twice a day, checking for symptoms, just to kind of follow. And so as soon as someone has symptoms, you would make sure you link into testing to evaluate. So the Camp Dawson situation was no different than the other returning travelers or other folks that we've been working with.
Could you provide more clarity to me how long the state was having to send its tests to CDC, and when the state transitioned to being able to do its own tests?
Yeah, we transitioned to being able to do our tests over the weekend, over this last weekend. And so we are now doing testing here in West Virginia. It's actually speeding up our turnaround time a lot, which is great. We're excited about that. And so it is actively happening here now. And
Is that at state lab in South Charleston?
that is our state lab, yes.
And you said that there's been eight people tested so far. Is that all at one location, and is that because that's only one location that they test?
No, these are around the state.
But local health departments can't do it yet, though, right?
There's no point of care test, like for the flu, you can go to a doctor's office and just do the test right there. It's not that kind of test. It's not one, it has to be a CLIA-approved lab and more complexity. So it's actually, the doctor's office can collect the specimen and then they get it to the state lab. Or if once commercial testing is more available, they collect that specimen and it goes to the commercial testing laboratory.
I'm just saying, like, you all get tested at health departments for some things, but not this.
Right, we're not necessarily routinely doing that because this is part of the healthcare system.
And commercial labs should be online relatively soon. We're told that's
Yeah.
coming very quickly.
Public health departments can, evaluate, do you need to be tested, and link you to being tested with that if we need to. But again, we won't try to integrate this into the healthcare system and get everybody up to speed. It's always challenging in the beginning, especially when things are changing rapidly.
This was
Yeah.
said earlier, just to clarify, the one test that's pending is at the CDC, it's not being tested in the city.
Correct.
Is there a reason why you can get tested online over the weekend, hold up on that one test?
I don't know the specifics of that one test. CDC is being inundated by lots of tests. And the testing, interestingly, the way it's under the EUA, so you may hear this when we talk about actual tests that are positive down the road. They actually, when they're tested at the state level, they're termed a presumptive positive, and then they get retested at the CDC to be, quote, confirmed. It's actually the same test. It's pretty standard. But if you hear the word presumptive positive, that just means it's a positive here, and it goes on. They may change that over time. That's just a standard thing for around the country.
And I did just hear at the conference call earlier today that I believe 2.5 million people have been tested, the statement was made, and there would be an additional 3 million more by next week, so they are doing more testing.
Would you anticipate the state will ramp up testing?
We are here and ready to go. I mean, but again, we're having to use those criteria, and we have probably fewer of those folks in some other states. That criteria of people that are have symptoms, it can be mild symptoms, but have a reason for exposure, or they have. These would be through healthcare providers, of course. We have people that are seriously ill. Serious enough to be at risk for or hospitalized, and not another cause for that illness. So we're still having to prioritize that grouping, given the testing ability that we have. But I think, again, as commercial laboratories get up and running, it'll be more widespread.
Yeah, and let me clarify, that may be testing kits.
I was
So
gonna
let
say,
me,
that's-
I believe that was 2.5 million testing kits and 3 million more available next week.
Yeah,
So
they're trying to
they're
ramp it up.
ramping up the number of kits available for states to test
Yeah.
and for commercial labs.
To confirm, if someone meets the threshold to be tested, they're at high risk, travel, whatever, is that covered by Medicaid? Is this being paid if they don't have Medicaid, with private insurance?
Yeah.
What's the cost?
When we test it through the state lab, there's no charge. We're not doing any charge for the state lab. Commercial testing, we have been working with, and we understand that insurers would be expected to be covering that. Our insurance commissioner sent out a memo to all insurers in the state that really outlines the approaches that they would ask their insurers to really reduce any barriers to testing and to care and to management. So there's several very proactive steps that many of our agencies, I think, are taking.
That's when you say no pay, you're talking about the actual test and not necessarily the doctor visit.
Right, exactly.
And that would include, like,
It's just for our lab. So, it may be that the doctor can still charge for the collection of the specimen through their insurance. Right, we're not charging, the lab is not charging for the testing that we're doing. Commercial laboratories, there will be routine, just like any other laboratory test.
Any other questions? We want to make sure we respond to everyone here.
And my understanding is they are assessing limiting access to visitors. What role is the state playing in that situation?
Yeah, we're really in close communication with them around that. And there are guidelines out through CMS around this issue right now. We're looking at, and we're in close conversation with them now about where we might apply that right here at what point now. So I think lots of good conversation about that, and I think we will they're big issues to wrestle with.
The biggest crowd right now, as far as say, is going to be the next 2 weeks, the basketball tournament. Have there been discussions about how to approach that event? Other states are clearly doing theirs.
You guys, you want to take that one?
State's chief executive will be there.
That's right.
Yes, Bernie Dolan, the SSAC Executive Director, actually texts every day, twice a day, for an update, and poor Dr. Slemp hears about that. But no, we're actually monitoring that. Mr. Dolan is very, very aware of the precautions. He's actually preparing statements to be made at the games and at the event, the same statements that you've heard the panel here talk about, which is just the precautionary the measures. He's also stressing very heavily that if your players or family members are sick, please stay home. Don't come down to the event. But at this time, no, the tournament will go on as planned.
And I think that emphasis is really important. Sometimes we get sick, we kind of just say, oh, we'll tough it out, I don't need to. I can still go to work, I can still go to the basketball tournament. We're asking, really, take it seriously. Protect yourself and other people, and if you're sick, stay home. Yeah.
This may be the first and last time I invite public officials to weigh in on how to do the job. The public, the media is just fanning the flames of this. What advice would you give us in conveying this information? How should we approach philosophically?
You all are great partners and great ability to get information out. And so I think it is really, there's enough I think you've got the opportunity to really just make sure you get accurate information out, that you help people and we help engage and mobilize folks to, in constructive ways, plan forward. And I think it's all about working in partnership with that. It is, we don't need to go panic. We need to be focused in how we work together and get the job done. And these are the times that it's really important to pull together to care for yourself, your families, plan with your communities. In West Virginia, we pride ourselves in being independent and in being resilient and in taking care of each other. And so I think we have an opportunity to do that. And we tap into those values and move forward together.
Let me just add, I agree with everything Dr. Slemp said, by the way, but in your articles, when you speak about COVID-19, again, put the website and the toll-free number in there. It is truly beneficial to folks to go to that website and read what their role in this is, and that can be the biggest help that we could ever ask for. So we appreciate that.
And be a credible source of information. There's a lot of misinformation, a lot of rumors, a lot of things that you can find out there. Just make sure you're using credible information sites and accurate, so that we can really make sure people have the right information to act on. Thank you.
Then thank you for the question.
It's a great question.
Any final questions? We probably need to wrap it up. We appreciate your time. Again, I apologize for the delay. You can blame that on the governor. But we will do this again as things change. We're certainly prepared to sit and explain the changes to you. So thank you all very much.